So my presentation, my session is very factual, lots of information, but this information is still on a higher level because I usually deliver the session about licensing option for the clients of the Access Center, and the session is for 2 hours. I cannot take 2 hours of your time, so I try to compress this information. And please, if you have questions, if you have want to reach out, feel free to email me, feel free to become the client. I'll be happy to guide you further. For now, we are talking about licensing options for international trade doctors, and I will be interchangeably using IMGs, the terminology, international medical graduates. This is usually how the term is used for foreign trained doctors in the official institutions in Canada involved with licensure. So first of all, a little bit about our organization. So we were Health Force Ontario once. Now we are called Ontario Health, or we are part of Ontario Health. So Ontario's Health Force, former Health Force Ontario, HFO, is a business unit that supports the planning, recruitment, retention, transition, and distributions of health practitioners in Ontario. Within this business unit, there is the Access Center for IHPs that provides information and resources to IHPs, internationally educated health professionals, to help them integrate into the Ontario healthcare system with the primary goal of helping them become trained, licensed, and employed in their profession or alternative careers. We are funded by the Ministry of Health of Ontario, so our services are free for everyone. Okay? So this slide is particularly related to the IMGs or ITPs, internationally trained physicians. So we provide advisory services. I'm the advisor who works with IMGs, and I have my colleague who works with other healthcare professionals regulated, all 25 of them, except for physicians. And we also have immigration advisor in our team. If you need further questions about the questions related to immigration, permanent resident status, what kind of job can I get, etc. So again, you can reach out to our immigration advisor with your questions. So for advisory services, I advise on pathways, information on licensing. I help you to develop the action plan. I support your applications for residency training, of course, I cannot have one-on-one appointments, but through the emails, through the sessions, etc. I advise you on alternative careers. We provide you connection with other IMGs who maybe reach certain level of success, the so-called peers-to-peers networking. And I also share my resources for the examinations and various stage preparations like Medical Council of Canada exams, BCCAP, language test, CASPER for the interview, FM Pro C, etc. We have sessions and workshops for IMGs. One of the sessions, and very important for newcomers, is Pathways to Certification for IMGs. Today's session is a compressed version of it. Finding opportunities in the Canadian healthcare system is open to all IHPs, and I talk at the session on how to find a volunteer position, how to find an observership position, what are the educational programs are most popular among IMGs, and a little bit about job search techniques. Alternative career options session is about basically where else I can work in healthcare. I'm not giving you the exact job posting or something, but I tell you what are regulated professions, what non-regulated, and talk about the key steps for the alternative careers, and speak in details about some very popular alternative career choices like physician assistant, like working in mental health, like licensed clinical assistants, etc. My colleague Shameen Mohammed, who works with other healthcare professionals, has a session, Competencies, Culture and Communication, Integration in the Canadian Healthcare System. Highly recommend you. During the CARMS application period, I hold a session, CARMS application process. Usually there are a session every 2 weeks. So I had one session last week, so next session will be next week and the 1st of November. If you're applying to CARMS or planning to apply to CARMS, you can attend. Residency interview skills for those who apply to CARMS, to residency positions. We have peers-to-peer session where we invite successful IMGs to talk in front of you. Every Monday, I have weekly session question answer 11 to 12 Toronto time. I can answer any of your questions related to the IMG issues, really any. Licensing, practice ready assessment, practice eligibility with alternative careers, general licensing, anything. And based on the needs, we may have group appointments. For example, MLP IMG interview, or someone is invited for Practice Radio Ontario interview, the group appointment where I coach them how to go for that. We have also online resources like website, pre-recorded webinars, physician licensing series, pre-recorded webinars for the CARMS applicants, interview skills, CARMS CV and personal letter. We can provide you with a CARMS application package where we explain you how to put together your CV, your personal statement, and how to prepare for the MMI. We have recorded peer-to-peer session on specific topics. Employer Resources Starter Kit is an online and very good e-learning resources. Prep, WIN, and ACP, mainly directed to alternative careers. And of course, we do referrals to settlement services, educational programs, language training programs, employment services. When we know about a job posting, we always share with you connecting to the employees in healthcare, and also now a platform for our clients. Other stakeholders do their info sessions. So lots of services, as you can see, within our resources. In order to have access to the services, you need to be a client. The registration is online, it's free. Please, if you're interested, join and get access to our services. Now let's talk about licensing. So, entry to practice requirement. To practice a regulated health profession in Ontario, you have to be a member of the regulatory college for your chosen profession, and you need to hold a certificate of registration from the college. Regulated health providers are required by law to deliver competent, ethical, and professional services and are accountable to the public through their respective colleges. So that's why the process is very rigorous. The process is very strict, because that's why the system is giving you so many requirements and so many things you need to do, because the main purpose of the regulatory colleges is to protect the public so that you practice competently, ethically, and at the professional levels. Okay, so about the IMGs, who we call IMGs or ITPs, the individuals who obtain medical degree or postgraduate training outside of Canada and the United States. So when you think about going for licensure, you really need to assess your circumstances and consider the following. First of all, there is no guarantee of obtaining a license to practice in Ontario or in any other province. No one can give you a guarantee. You come as a doctor, you will be working as a doctor. No one can give you a guarantee. No one can give a guarantee even to Canadian medical graduates who go to medical school that they will be working, because lots of depends on many things. The licensure process for IMGs has many stages and can seem very complex. There are differences in the registration process between provinces and territories. So some regulations are in Ontario, some in Saskatchewan, some in British Columbia, etc. You probably know already about that. Also, there is significant financial and personal commitment required to pursue license. So these are the considerations you need to have when you start the licensure process. But my experience, according to my experience, I would say 95% of all IMGs, they still try to get to their first plan A is to get their license in their original profession. So what you need to know when you start your journey to licensure. So there are certain institutions that are related to licensure and certification in Canada. Medical Council of Canada, or short name MCC, that includes Physicians Apply, is a part of the Medical Council of Canada that has several functions like verification of your medical credentials, exam registration, access to the medical registration to various provinces, etc. The Royal College of Physicians and Surgeons of Canada is the college that regulates the specialties other than family medicine and establish the standards of training. They also conduct a certification exam. The so-called board exam in Canada is called certification exam. And all specialists do certification exam with the Royal College. And all family doctors do certification exam with the College of Family Physicians in Canada. So basically in Canada, there are two boards. One board, the College of Family Physicians of Canada for family medicine specialty, and another board, the Royal College, for all other specialties. And the fourth institution, so to say, are the provincial medical regulatory authorities. And the name usually starts the College of the College of Physicians and Surgeons of the province, of Ontario, CPSO, of Alberta, CPSA, of Saskatchewan, CPSS, etc. So, and let's look at what their functions are. Well, first of all, Royal College, College of Family Physicians, and Medical Council of Canada, national bodies. The medical regulatory authorities are provincial bodies, and their functions are different. The only body that gives you license to practice medicine is the Medical Regulatory Authority, CPSO, in Ontario. It's not Medical Council of Canada that gives you Licentiate of Medical Council of Canada, LMCC, qualification. Remember, although it says Licentiate of Medical Council of Canada, it's not a license to practice. It's a qualification and manifestation that you pass the Medical Council of Canada exam. It's the College of Physicians and Surgeons of the province that gives you the license, the registration. The function of the Royal College to accredit specialty residency programs and conduct certification exam. The function of the CFPC is accredit family medicine residency programs and conduct certification exams. And Medical Council of Canada role is conduct qualifying exam. Qualifying exam part 1, MCCQE1, and the NAC exam, National Assessment Collaboration, the clinical exam. So this is in a nutshell. So in Canada, basically, to have full independent license, you need to pass 2 sets of exams. First, qualifying exams, which is the MCCQE1, and this exam tests general medical knowledge and clinical patient skill. Who can do this exam? What's the eligibility? Any physician with a medical degree. The second set of exams is specialty certification exam. So it's either Royal College for specialists, I already mentioned, or College of Family Physicians of Canada for family physicians. So these exams, both written and applied, 2 parts of this exam, they test the physician's knowledge and clinical skills in their area of advanced training, residency, fellowship. Usually these exams in Canada, Canadians do after they finish their residency training. So who is eligible to do this exam? And this is, you see the red letters and 3 exclamation marks. And this is where the bottleneck is for the IMGs. Because when you come to Canada, while you can do the qualifying exam, you cannot have access to the specialty certification exam very easily. You need to do certain things. So that's why when I have a session that it says pathways to certification, means what are your pathways to have eligibility to the certification exam? CFPC if you're a family doctor, general practitioner, or Royal College if you're a specialist. And this is the topic of today's session in a compressed version, okay? So this slide shows you the simplified formula to have eligibility for independent license. For independent license, you need Canadian citizen status or permanent resident. Remember, it's independent because there are other types of licenses, okay? So you have to be licentiate of Medical Council of Canada, which means that you have to pass the MCC QE1 and either QE2 or have 1 year of postgraduate training, including in your home country. And the third component is certification, Royal College or CFPC. And this is, again, I underline, most licensing issues for foreign physicians have to do with lack of eligibility for certification exam. What are the pathways for certification? There are 5 of them in Canada. One pathway is called jurisdiction-approved training. I'll explain it later, what it means. Second pathway, if you do residency in Canada, postgraduate medical education in Canada, you apply through CARMS. Third pathway is practice-ready assessment programs. Fourth pathway is Manitoba only, Manitoba licensure program for international medical graduates, and it's for GPs, family physicians only. And the fifth pathway is practice eligibility, currently only for specialists. So what is a jurisdiction-approved country? If you have your postgraduate training as a specialist in Australia, New Zealand, Hong Kong, Singapore, South Africa, Switzerland, Ireland, United Kingdom, United States, or you completed residency training program in internal medicine from this university in Chile, in neurology from this university in Saudi Arabia, in anatomical pathology, pediatric surgical foundations from this university in Kuwait, then you have immediate access to the restricted license to practice. I'm talking about Ontario at this point, you understand, we are Ontario Health, and access to the certification exam. Immediate access to the restricted license and access to certification exam if you have done your postgraduate training in those countries or these programs, because Canadian system recognizes this training. What about family doctors, general practitioners? 4 countries only: Australia, Ireland, United Kingdom, and United States. That's it. So you finish your postgraduate training, your residency training, physical present in those countries. You also have access to the restricted license to practice in Ontario immediately, and you don't even have to do the certification exam. It may be granted without examination, That's why many IMGs go to do postgraduate training in the United States. Or some of them who are disappointed and disheartened here after several attempts, they do plug 1, plug 2, and they try to engage in their residency training in the UK or Ireland. Okay, this is just the reality that I'm sharing. I'm not saying that it's a good thing or right thing. I'm just telling you what it is right now, just giving you the information. Okay, so, but your training is not from approved jurisdiction. So then what? What is your pathway to certification and where to start if you haven't started yet? I'm sure that some of you already started, if not all of you. So the first steps are you need to open an account with physiciansapply.ca. You remember, this is the portal within Medical Council of Canada that verifies your credential. You need to submit the documents for source verification and start preparing for the MCC exams. So why verification is needed? A verification is different from evaluation of your credential done by WIS, ICAS, etc. Actually, physicians apply through the American counterpart ECFMG is verified that your medical degree is in fact your medical degree, that you went to medical school, that you got this medical degree, that you didn't buy it, you didn't fake it, you didn't Photoshop it. So that means source verification. And sometimes it's very fast, but sometimes it's a very long process. And lots of things depends on how your medical school responds to that. And for those of you who decide to pursue not only postgraduate training in Canada, but let's say practice ready assessment or practice eligibility route, I recommend to verify not only medical degree, but also your internship certificate, your residency training certificate, and your current license or past license. I mean, the license that you practiced most recently. Okay? So as soon as you submit your documents for verification, and the MCC, physiciansapply.ca, gives you a green light saying that we receive your documents, and order the verification process begins, you can start preparing for the MCC exams and you can take them. You do not need to wait until the verification is done to take the exams. Please do not fall for this mistake. Some of you think that, oh, my documents need to be verified and only then I can take your exam. No, that's not true. The verification process can continue and you start taking the exam, preparing for them. Don't waste your time waiting because it takes time and your exam preparation takes time. Okay, you can do it in parallel. So these are your first steps. What are the exams that you have to do with an MCC? It's QE1 exam and the National Assessment Collaboration, it's a clinical exam. And you know that QE1 exam, it's a computer-based exam, and they have 2 parts, the multiple choice and the clinical decision-making part, but it's a computer exam. And the NAC exam is clinical, you need to be physically present. While QE1 you can do anywhere, there are 80 prometric centers across the world. The NAC exam needs to be done in Canada, clinical exam stations. So what's important? You need to remember that MCC exam scores matter, especially if you decide to apply to the residency training through CARMS. because the programs will look at your exams, and if there are 20 other IMGs applying for one position, they will pick someone with a higher exam scores because it's a manifestation of your solid medical knowledge. And remember, you cannot retake the QE1 if you receive the passing score. If you fail it, you can retake it up to 4 times. Like 4 times attempts altogether. You take one and then 3 more times to retake. But NAC exam, you can do 3 times to improve your score. QE1, you pass, you stay. So when you hear those sad stories about IMGs, most likely these are the IMGs who received the low QE1 score and they lost their competitiveness for applying to residency training. I'm not saying that IMGs with low scores never match. No, that's not true. That's not true. I'm saying that IMGs with a high exam scores have better chances to match and better chances to go through the system because they demonstrate solid medical knowledge. Okay. What's important also, the gap in clinical practice is a negative factor in your CV no matter. And I know I probably step on your very, very soft spot. And this is a very painful sport because of your life circumstances, you cannot practice clinically. And that's why when I was talking to Leo, you need to look for all other ways how to address this issue, how to get involved, what you can do, etc. Okay, so when you're talking, okay, what are my chances? I cannot tell you, each of you, what are your chances. What you need to remember that there are usually, when you apply to residency, there are 4 selection criteria that the program is applying. They're looking at your exam score. They're looking at your recent practice or training. They're looking at your exposure to the Canadian healthcare system because they think that you are easier to train if you're familiar with the system. And of course, every program wants to pick someone who is committed to special, to have interest in special. And also personal professional qualities like teamwork skills, leadership skills, communication skills, collaboration skills like teamwork, I already mentioned, empathy, compassion, professionalism, etc. So all these qualities they're looking for. So work on this, on each of those selection criteria. So another pathway is practice-ready assessment programs. Right now, the practice-ready assessment programs are in 9 provinces. Ontario, PRO, BC, PRA, BC, Alberta, PRA-B, Saskatchewan, CIPA, Manitoba, PRA-BFP for GPs and family doctors, and PRA-MBSP for specialists. New Brunswick, PRA-MB, Nova Scotia, NSPRAP, Newfoundland, PRA-NL, and Quebec, CMQ assessment. So all these 9 provinces, they have programs for general practitioners, family doctors, and only 2 provinces have officially practice-ready assessment for specialists. It's Alberta and Manitoba. You want to know more about that?
We will have to wrap up this really
okay.
shortly. Yeah.
Okay. So I have to stop now, right?
2 more minutes?
Okay, I will do very quickly. So MLP-IMG, it's 1-year training program, University of Manitoba. And practice eligibility route, I highly recommend to look into that, those who are specialists. Because if your training is acceptable to Royal College, you may have access to certification exam. You really, really need to look in what the requirements are. In Canada, internal medicine, pediatrics, 4 years, other specialties, 5 years. Connect with me if you have more questions about that. Okay, so other IMG licensing options: Alberta Clinical and Surgical Assistant Program, Clinical Assistant License Nova Scotia, Clinical Assistant License Manitoba, Clinical Assistant License Newfoundland Labrador, Associate Physician License British Columbia, Physician Assistant Programs in Ontario, Manitoba, not specific for IMGs, Clerkship Programs in Quebec and Nova Scotia admits limited number of immigrant IMGs in the year into clerkship, 3rd and 4th. And this is our, sorry,